the real importance is in making a diagnosis. So there are all the HD phenocopies, or all those that we know about at the moment, are inherited. They're inherited in an autosomal dominant fashion, just like Huntington's disease. And that means that once you make a diagnosis in a family, there are implications certainly for the offspring of that individual, who would be at 50% risk of having the condition. So for some of these conditions, some of the phenocopies, like for Huntington's, there is what we call anticipation. So the children may develop the disease earlier than the parent. For others, there may not be anticipation, but in dominant conditions in general, there is, or there can be, quite significant variability between different individuals. So certainly there are implications for offspring. And again, mostly because it's an autosomal dominant condition, the affected individual would have an affected parent, or a parent with a smaller mutation that's become big enough and tipped into the disease range. So certainly there may be risks for siblings up to 50% of similarly being affected. So obviously making a diagnosis has enormous implications for family members. At the moment, perhaps that impacts less on therapy, because most of the therapy is directed at sort of controlling symptoms more than it's directed in any way to cure. But as we move into the realm of treatment and sort of gene-specific treatment, then obviously you're not going to be able to give a gene-specific Huntington's treatment for a Huntington's phenocopy, at least with what we know currently. But certainly, these are rarer diseases probably than Huntington's. And again, for families, that means that there may not immediately be a cure or a therapy which is directed at that condition. And I think it's worth commenting that in the scenario we currently have, where a third of the patients with that HD phenotype, at least in South Africa, have HDL2, some of the newer and very exciting developments for HD would not be applicable to a third of our Huntington's cohort. And so at the moment, not that we quite at the level of therapy, but in a way, a third of the patients are being perhaps denied the developments and the newer developments in Huntington's because it's a rarer disease, and the research is not at the moment being directed at developing a therapy for HDL2 and the other phenocopies perhaps as specifically as it is for HD.